Let's get started. So Monica has a wealth of knowledge that she's excited to share with us today. So please feel free to post your questions throughout the event,
anything you'd like.
right? She's a question answering machine, I promise you, and has really interesting things to say. So tell us, to begin with, how did you start offering the DefenAge range of science-based skincare in your practice? Because you've been at it for quite a while now.
So DefenAge came on the market in 2016. I happened to be at a conference I was speaking at, and they had a booth, and I went over and wanted to know all about this. And for the first time, I heard about DefenSense, which I'm going to educate you about. And they gave me some generous size samples, and I kid you not, Wendy, before I left the conference that weekend, I put in my first order.
Oh, wow.
I loved the product. I loved the science behind it. And it has been with us since. My staff, especially my clinical estheticians, really like DefenAge and have become ambassadors for the product.
That's so nice to hear. It's really great to hear that you've incorporated it that way. And once the estheticians love it, then you know. I mean, I have a lot of respect for estheticians, and they're my go-tos right next to doctors because they work with these products every day and they know what works and what doesn't for their client's skin.
Yes. And in all the time that we've had it, you know, skincare is good when people without appointments will come into the office to purchase it, and there are no returns. I think we had one international traveler who their bottle got scrunched and she couldn't pump it, and then when she came back from her travel, we changed the bottle, and that's not a fault of the company. I blame it on TSA and
yeah, right.
Right.
They are not skincare friendly. Would you agree? I've had more fights at TSA. I'm lucky I haven't been put in federal prison.
Oh my gosh. Yeah, so that's really my litmus test of if a product is good and if people that use it like it, is if I get returns, and we don't with DefenAge.
And if they come back to replenish, then you know you're doing something right.
Oh, absolutely. I mean, before COVID, not many skincare lines were offering online shipping. You know, California is not like New York where everything is vertical. We have plenty of space, so we all, as physicians, love to carry the skincare products that we offer in our practice. And so before COVID, we didn't really have online shipping. And people without appointments would come back and buy their product.
I mean, online shipping, I think, has taken over even cosmeceutical skincare because during COVID, we were home, and many practices, at least in New York, we had 3 months of no practices open. So it was great to, if you couldn't get your injectables, at least you could get your skincare and do something for your face while you were sitting there watching endless CNN. Right? Oh my God, I don't miss those days. I've heard you talk about the 5 R's. And how do you explain this interesting concept? Because I love the way you formulate it in a very different, fresh, I think, approach. So I'd love you to enlighten everyone about how that works in your practice and how you came up with it.
So it's a very overwhelming, populated arena. Being a patient and trying to figure out what to do for your skin is somewhat daunting. And I really needed to make my philosophy known to my clients and also have a kind of an approach of what I do for people. So I want to start with things that are effortless. They cost the least and work the best and don't have downtime and have great results. Well, DefenAge is on top of that list because I know that if my clients start on this skincare product, they're going to have results and really be happy. The R's also stand for Relax, which is our neuromodulators or Botox. Then it's our fillers, resurfacing devices, and tightening and lifting devices. And, with that philosophy and the curated procedures that I offer, I know that I can get a really um, customized treatment plan for my patient that isn't difficult to achieve, and they're getting results with every step. So the 5 R's are my rejuvenation philosophy.
I think it's a great way to frame it because I'm sure first-time clients must be completely overwhelmed with everything they're seeing online and on Instagram, for that matter. And how do they sort through it? I mean, they really need to ask questions. I think you've really simplified it, definitely. So what are you doing lately? What are people asking for outside of the realm of skincare? What kind of treatments are they asking for most? I mean, we're getting into summer. So
Yeah.
in New York, at least, things really change for summer because people are obviously going to spend more time outside. You're in California where you're outside 12 months out of the year.
12, exactly, 12 months out of the year. And God forbid if it rains for 2 hours, we just lose our mind and don't know how to even drive.
You
But
are so
anyway, um, skin health is very important in California, and I can totally tell between my coastal practice and 100 miles in at the desert practice, there's a lot more skin damage with
message.
the desert practice because they're older and haven't really had good skincare to protect themselves. So skin health is important, and I have a good colleague who says it's the bacon around the turkey. Um, and he says, I don't know why the Koreans didn't get my joke. Well, maybe they don't eat bacon or turkey. But skin health is very important, and people want to look refreshed. And so the types of treatments that we're doing really go hand in hand with skincare. Microneedling is really big, and thread lifts are really big on this side of the country.
Well, they're big. They're big on this side of the country too. Maybe not as much, but how do you tell us a little bit about microneedling? Because I'm fascinated by that. I think those treatments are great. I've had several on my own and look forward to having the next one. How are you using it, and who's a good candidate for it? And what do you use before and after in terms of topicals?
Okay, so microneedling comes in many different forms. They're automated pens that have multiple microneedles attached to the pen. The pen brings the microneedles up and down and pierces the skin. With the sophisticated devices, you can actually dial in the depth of the penetration. And my pet peeve is that please do not use a home unit. These microneedles are one-time use in the doctor's office. And the person that tells me, oh, I clean mine, it drives me nuts because unless you have a $10,000 autoclave, you cannot clean instruments that are touching your skin. And those are not made for autoclaving anyway. And you can actually dull the microneedles, and that can cause scarring on your skin. But anyway, we cause micro injuries with microneedling and then introduce good skin care to the skin, and that kind of stimulates even your puppy wants some skincare.
Exactly.
Yeah.
Hey.
So the microneedling causes micro trauma. We introduce good skincare, and you have a plethora of new skin coming to the surface, and you can really change the skin with a series. As far as a good candidate, early aging, late aging, scarring, pigmentation, those are all good candidates for microneedling. And it goes hand in hand with The company says use this 48 hours after microneedling. I have tons of experience applying it directly on the face after microneedling, and these people do fabulous, and they never want to run out of their DefenAge.
And are you using the serum after microneedling or one of the other products or both?
Yes, I'm using the serum. And what's interesting about the serum is that when DefenAge first came out, we had the cream in the serum. And everyone would ask, well, what about an eye cream? What about an eye cream? And what we found out is that the serum was actually started to be an eye cream, and because it was so result oriented that they decided to actually change it to an all over face cream. So the product line is very simple. For the face, you wash, you apply your cream, and then you apply your serum, which is kind of the reverse of other skincare lines, but it has to do with the active ingredients and what it does to your skin, closing what we call the tight junctions, or the holes in between the surface of your skin.
And do you not use any of the microneedling devices that have energy, like RF energy?
Oh, I do. We actually have a great one called Vivace, and it's microneedling and radio frequency, and that needs a physician to operate, or a nurse practitioner, or a physician's assistant, whereas in my state, microneedling can be done by our estheticians.
I mean, both good options and probably are complementary depending on the patient, one time or another.
Absolutely, yes. The radio frequency helps with a bit of lifting, which I use for our patients who have a bit of laxity in their skin.
I've had RF microneedling with the Secret Pro, and I love it. I've also had
great.
InMode devices. I think microneedling with RF is just an amazing treatment that seems to be really good for almost anyone. I've never had it without the RF, but I know that that's kind of the traditional.